Well, hello all. Welcome back from what was a nice weekend and obviously the first since we began phase one of our Renew PEI Together plan. Dr. Morrison will provide a regular update in a moment. I just wanted to start by saying that it was nice to see many Islanders out and about taking advantage of the lovely spring weather, in particular yesterday. In my conversations with Dr. Morrison today, the general consensus is that we were all pleased to see in the first weekend of phase one that most Islanders were strictly adhering to the CPHO health directives, that people, while appreciative of the opportunity to move about a little bit more freely, we're still taking very seriously the physical distancing and other measures that have helped us get to this point in time as a province. Obviously, when we developed the framework for our plan, it was built upon the need for Islanders to continue to follow the public health directives. The strength of our position is largely because Islanders have bought in, and as we continue to ease back, that buy-in is even more important. So it was great to see that we are off to a strong start, and we just want to keep reaffirming the need for that to continue. We've had a lot of feedback and interaction from Islanders from all walks of life, from the business community, from education, from so many others, around the continued need for clarity and guidance as we move through the days of these phases. I know CPHO and Dr. Morrison will address this in her address, that have been working hard to assist with the process, to help with some clarity and to continue to offer guidance in the days forward. I think it's important for Islanders, again, to remember that we are working through a lot of unknowns and a lot of situations that we've never had to deal with before. We have been open with our position that there is no right or wrong way clearly defined to do this, and that we are very much open to trying to make adjustments along the way if we can, but that we are committed to rolling out our plan carefully, with caution, and with the hope that we do not have to adjust because we are going backwards. So it is also important to point out, even if it doesn't feel like it because we've been cooped up for the past couple of months, these are still very early days. We are quite a bit ahead of the curve when it comes to other jurisdictions. And as we have said many times, we are here because we have put in a lot of hard work. And as we progress through the phases of our plan, it will require continued effort and work. It will require patience, not just from Islanders, but from all of us in government as well. Even if we may not all agree on the timing, I do think that we all want to get to the same place. And in the process of doing that, we all need to show some flexibility, some open-mindedness, some patience, and some understanding. So again, I think that the weekend was really a positive start, but it was just the beginning. We have a lot of hard work ahead of us, and but I do think that all Islanders feel that it feels really good to start the process to be making our way back. So with that, I'll turn it over to you, Dr. Morrison.
Thank you, Premier. So I'll start by saying that we do not have any new positive cases of COVID-19 to report in Prince Edward Island. 25 of our 27 cases in Prince Edward Island are considered recovered. We have 245 new negative tests to report from the weekend. Just to note, in Canada, the case fatality rate for the over 59,000 cases is 6.2%, and a significant number of our cases and deaths in the country are related to long-term care. Again, across the country, our rate of hospitalization for the cases is 16%, 4% of those in the intensive care unit. I continue to encourage Islanders who are experiencing symptoms related to COVID-19 to call their physician, nurse practitioner, or 811 for referral for testing. And it's important that we continue to test individuals ongoing, especially as we move through this next ease back process. And it ensures with testing that we can easily isolate potential cases and do contact tracing to prevent further spread of COVID-19 in our province. I know in follow-up to some questions from last week, people were wondering who who actually is coming to Prince Edward Island, and just thought I'd mention more specifically in the last couple of weeks, the people who are coming to Prince Edward Island. There's a number of permanent residents, and these would be Islanders who are returning home from international travel, who didn't get home initially in March, students coming home from university, some who were working coming home from west, and Islanders who actually had to get something or pick something up outside of Prince Edward Island and are returning home. Of course, workers who are coming into Prince Edward Island, a number of people arriving for compassionate reasons, some for medical exemptions or who've had medical appointments off the island and are returning home, some who've had veterinarian appointments or custody exchanges, just to give some examples. So as the Premier notes, we are now a few days into phase 1 of Renew PEI together, and this past weekend, the island, especially yesterday, was maybe a little bit more lively than it had been in the last weekend, and with more of our driveway and deck visits and children outside and many Islanders out fishing, which was great to see. As predicted, some of us have wanted to move faster, and some want to move more slowly. And aren't we fortunate to be in such a position where we're having these kind of discussions about which 3-week phase we see ourselves versus the impact of discussing how many people are in hospital or dying of COVID-19. So this week is Canadian Mental Health Week, and mental health is always important to our well-being and overall health, and especially right now as we cope with a new reality. Here in PEI, there's support for those going through difficulties and needing to speak with a professional or access resources. And Islanders can also call 1-833-533 9333 and select the option for mental health and addictions to easily find out what services are available and how to reach them. And supports are also available through organizations such as Family Services PEI, Canadian Mental Health Association, and the PEI Family Violence Prevention. As always, anyone who is experiencing an emergency health of any issue, please call 911. I appreciate that many sectors and industries are anxious to start preparing for how they can get ready to open or offer their services during this very global pandemic. And our office has been working on guidance documents for a variety of sectors and industries. As these are completed, they are being shared with industry, and some of the general guidance documents will also be on the Renew PEI Together website. This includes the template for the operational plans for businesses and organizations, which is now available on the website. As the Premier mentioned, the plan is a framework, and there will be adjustments as needed going forward. My biggest concern is that we will have to adjust to make things tighter. I know we're asked, can we make adjustments to make things go more quickly? And as the Premier points out, I certainly urge patience as we go forward, but we will make adjustments on a variety of things and change wording if we need to. One of the areas we've received questions on is around carpooling for workers, and Islanders may require essential transport for things like carpooling for work or co-workers in fleet vehicles and transport for medical appointments and other essential needs. So if physical distancing cannot be maintained, every effort should be made to ensure distance between passengers, including limiting the number of persons in a vehicle. And again, enhanced cleaning and sanitizing of frequently touched surfaces in the vehicle. So we will also be posting on the website some guidelines specific to carpooling for workers, and that will be available online later on today. We've also received various questions about how COVID-19 could affect animals, and it's important to note that the pandemic is being driven by person-to-person transmission, and to date, reports of animals becoming infected with COVID-19 are believed to be cases of human-to-animal transmission, usually from an infected owner to their pet dog or cat. So if you have any COVID-19 symptoms or are self-isolating due to contact with a COVID-19 case, you should follow similar recommendations around animals as you would around people in these circumstances, including avoiding close contact. When I was putting one of my children to bed over the weekend, she was tearful and said, "I just want everything to go back the way it was a few months ago before COVID." I told her I do too. But I went on to tell her, and I say it here too, we can't go back to the way it was before the global pandemic. We have to go forward and look ahead. It feels different, and it will be different. We are all experiencing this pandemic together. So as we go forward, let's go forward together patiently, kindly, and looking out for each other, and looking out for each other together. Thank you. Quelques mots en français. Bon après-midi. Aujourd'hui, il n'y en a pas de change. Nos chiffres continuent à 27 confirmés, mais maintenant, il y en a 25 rétablis. On a fait les tests de 245 plus tests négatifs ici à l'île du Prince-Édouard pendant le week-end. J'encourage toute personne qui présente des symptômes de COVID-19 de se faire tester, et les tests sont un élément clé pour le succès de notre plan de renouveler l'île du Prince-Édouard. Ça nous permet d'isoler les cas éventuels et de faire le suivi nécessaire pour minimiser la propagation du virus. Cette semaine, c'est la semaine de la santé mentale et c'est organisé par l'Association canadienne pour la santé mentale. La santé mentale est essentielle pour notre santé et notre bien-être, et surtout pendant la pandémie et notre nouveau quotidien. Il y a des appuis disponibles pour ceux et celles qui ont besoin d'aide. Les insulaires peuvent aussi composer le 1-833-533-9333 et sélectionner la ligne pour les services de santé mentale. Et puis, il y a aussi des appuis disponibles pour l'intérim des services familiaux, l'Association canadienne de santé mentale et le service de prévention contre la violence familiale. Et pour toute urgence de santé, vous devriez composer le 911. On a passé notre premier week-end de la phase 1. On a pu voir les communautés insulaires plus animées depuis plusieurs semaines. Des visites de patio, les enfants jouaient dehors, les gens en train de pêcher. Ça fait du bien de voir tout ça. On a eu de nombreuses questions sur le covoiturage. Et puis, cet après-midi, il va y avoir plus d'informations en ligne sur le site Web. Et on a aussi eu beaucoup de questions sur les animaux et la COVID-19. Et il faut noter que la transmission de ce virus est d'une personne à l'autre. Et les cas positifs de COVID-19 chez les animaux sont une transmission d'une personne à l'animal. Mais si vous présentez ces symptômes ou que vous êtes en isolement, voici quelques... il faut encore, juste avec comme les d'autres personnes, ayez un peu de distance avec votre animal. Continuons à suivre les mesures sanitaires. C'est important et essentiel, surtout pendant la phase 1. Restons patients et calmes. Soyons gentils les uns vers les autres. On est capable. Ça va bien aller. Merci.
Merci. Thank you very much, Heather. We will now turn it over to some questions from our friends in the Island media.
Brian Higgins, CBC. Good afternoon. Premier King, I think you mentioned that businesses and schools are seeking more clarity, and I'm wondering if you or the Chief Public Health Officer can tell us more about specifically what issues they're seeking more clarity on and how you're going about getting the answers, what kind of factors you have to weigh to come up with answers for them.
Well, I'll start, and then Heather, perhaps you could fill in. But I know one of the questions we do have is from education, just in terms of if teachers can safely go to school, operate out of their classroom to do some of the things that education is exploring for them to do. So there's a needed, more clarity around that. And I just think many of the businesses across PEI, when they look into the 3 phases that we've rolled out, they're trying to better figure out where they fit in and trying to really get a more firm grasp on what are the requirements they need to do to operate safely for staff and for customers within that framework. So, I think in many regards it is just you'll see business or islanders saying, I'm glad I'm in here. I wish I was 3 weeks later. Some saying, I wish I was 3 weeks earlier. All of those conversations that we are having, obviously, but I think it's just more of a greater need, as Heather talked about carpooling. For example, there's just a lot of these questions that pop up. And over the weekend, I know the Public Health Office was working diligently to come up with a lot of these guidelines for as many sectors of the economy and others as possible. So.
Thank you, Premier. I think just to add to that, I think some of the guidance, Brian, that, for instance, businesses may be looking for, maybe more clearly outlined on the template to help them figure out an operational plan. And it would touch on things such as making sure that wherever possible, physical distancing is in place. There's enhanced cleaning. There's enhanced hand washing availability. Employees, for instance, are screened for illnesses, so they're not coming to work if they're sick. Those would be some of the things that I think will help as we go through this. And some of these measures will be important not just for COVID. I think it'll be interesting to see how some of these measures get applied over a longer term in terms of enhanced cleaning and hand washing, which we've been talking about, which are important for transmission of other viruses.
Louise Martin, CBC.
Hi, good afternoon to both of you. I think you can both probably address this question. You both have already sort of talked about it a little bit, the first weekend of phase 1 and with some of the relaxed measures. How satisfied were you with what you saw? Was there sort of increased enforcement out there, sort of monitoring different sort of hot spots, maybe trails and things like that? And did we see any more warnings and or charges laid over the weekend?
Do you want me to start? I would just say that overall, I think I was very pleased. I do think we're in this position, as I said from the outset, that because Islanders have taken a great responsibility and they have been very, very aware of what they needed to do, and I think they have taken that very seriously. And overall, I think that was extended to the first weekend after phase 1. I know I drove around a bit. I saw a lot of people fishing on the banks of the streams and ponds, and they were all, distanced more than what they would have needed to be. I think we've seen people walking out and about, and I just think overall that the response has been good. I think that, Heather could probably speak a little bit more in terms of whether there were added warnings, et cetera, but generally overall, I think Islanders were quite responsible.
Hi, Louise. So I don't have updated numbers in terms of any charges or warnings that were laid over the weekend, and so I certainly can bring that back on Wednesday to the media. We did get a couple of calls over the weekend from people who had seen, calls of concern and reports, I know on the 1-800 line. But again, I don't have exact numbers. Our ground search and rescue folks were through the Emergency Measures Organization were out at some of the provincial parks, and I think there were definitely more people out walking around, but there was a presence there to again try to encourage the physical distancing when you're not in the same household. So I think overall, we're all learning. We've said this right from the beginning. We're all learning as we do this, and this is a start. And it's really good to start making these first steps. And we've said one step at a time, and we definitely made a couple steps on the weekend.
Appreciate your time.
Okay,
Thank you both.
Thanks.
Junie, The Guardian.
Hi, good afternoon to you both. Question to Premier King. There's, I guess, been some questions that have sort of been floating around about the Premier's Economic Recovery Council. Just wondering if you can tell me a little bit about, I guess, sort of what the composition of this council is, like who's on it, and I guess what the activities have been in the last month or so.
Yeah, well, I think there's two components to that, Stu. I think right off the bat, we brought a group of people together to try to help us better understand the business community, the needs they have in the immediate, and that was been a very helpful group. They help to give us a sense of what some of the program response that we had actually developed and implemented, which was very helpful. We also have a group together that we're looking at more of the sort of post-COVID, how our economy needs to change and to adapt to the post-COVID recovery process, which we think will be and have been saying will be a lot longer, perhaps, than the actual virus will be here. So, we can certainly be in a position later in the week to probably give some more details as to the complete composition of that. But we've had ongoing conversations with groups and individuals from the business community, from the labor community, from municipalities, and that will continue for sure.
Okay, thank you.
Rachel Collier, Eastern Graphic.
Hi, this one's for Dr. Morrison. I'm wondering if you could be a bit specific about what evidence, information, or ideas are giving you confidence that hair salons could work in a way that would adequately mitigate risk for workers and the public. I'm wondering, maybe you've seen a plan that seems adequate, but what would that look like? And I'm also curious, what responsibility do you feel the province should take to possibly lessen competitive pressures within the industry to maybe start before it's safe to do so?
So I'll start with the first part of your question. So I think we've been our office has been in touch with the association, for instance, for hair stylists over the weekend, and that guidance is expected to go out through their industry today, and I think that may help answer some of the questions that they have. Similar to Saskatchewan, I believe, and a couple of the other places, the phase that they are included in is similar to some of the other provinces, so that is certainly in keeping with that. We have to remember that what we're doing is looking at population level risk. What kind of encounters do you have? How often that happens? Is it face to face? Is it what mitigation risk can be put in place? Is it and like anywhere else, every place would need to have an operational plan that looks at being able to do enhanced cleaning, hand washing, and different aspects of that. So it's something that we're working on. It can absolutely, we've said right along, people need to feel comfortable as much as possible, but understanding how the virus is transmitted and what the risk is. We've also talked about the role of non-medical masks in situations where physical distancing may not be able to be maintained, and that is going to be included in some of that guidance out. So certainly appreciate there's concern amongst all of us as we go forward with each of these steps, and recognizing that there are others who are very anxious also in similar types of professions to be working as well. So we are looking at what is going on around the country and what the risk is about the virus, and that we continue to learn through a technical advisory committee, special advisory committee nationally, and we'll continue to do so. And as I know we already are going to be making some adjustments on some of the guidance for retailers. We'll continue to do that as necessary with other groups.
Thanks a lot.
Okay.
Laurent Rigaud, La Voix acadienne.
Good afternoon. I will ask this question in English, but Dr. Morrison, you can answer in French, please. You said earlier that some people think that the 3 weeks between each phases it's too long. Others think it's too short. Can you elaborate a little bit on that? Where does these comments came from? I mean, is it from the retailers, from the shops, from the businesses, from the public?
Okay. Maybe I'll answer in English first, and then I'll answer in French. I think we've gotten comments from all of the above, and that you mentioned, and a real concern around not wanting to go too fast. We've had some people email and some organizations email saying, please don't go too fast. We've done so well, and we want to keep our island protected, and so be careful. We've had others saying, look, we really think, we've done so well here, why can't we go faster? And so we've heard from not just one particular group necessarily, but various. And so I think every time we come out here, we're trying to be very clear about why we're doing things. For instance, a lot of it being based on outdoor activities, primarily because what we do know is that the risk may be lower outside of transmitting virus than inside. In terms of the 3-week measurement, some would say we really should be doing it in 4-week increments, because would be 2 incubation periods of the virus, so a total of 28 days. We've decided here to try to do this, and I think it's reasonable to do it in 3-week increments, to recognizing the incubation period and then making sure we can get testing and processing done within that period of time, given the number of cases. So it's certainly a variety of people. Alors en français, il y en a vraiment, on entend de partout. Il y a des personnes qui sont très confortables et puis ils veulent qu'on aille tellement lentement parce qu'on ne veut pas avoir un grand nombre de cas ici à l'île du Prince-Édouard. On a bien fait jusqu'à date, alors pourquoi aller trop vite? Et puis, on va avoir un problème si on va trop vite. Et puis, on a d'autres qui veulent aller, on n'a pas de problème ici, ils veulent voir qu'on ouvre ça un peu plus rapidement. Et puis aussi, on a d'autres personnes qui pensent, même d'autres collègues qui pensent qu'on doit aller à chaque étape avec 28 jours, parce que c'est 2 périodes pour le virus. Mais on a décidé, puis je pense que ça fait du bon sens d'aller avec 21 jours ici quand même, parce qu'on n'a pas tellement de cas, et puis on a accès aux tests qu'on peut faire ici.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Une question en français pour vous, Dr. Morrison. On a vu, aujourd'hui, vous nous annoncez un 25e cas rétabli. On a vu en fin de semaine le Nouveau-Brunswick arriver à un total de tous les cas dans la province qui sont rétablis. Ma question pour vous, à quel point, combien de temps encore ça va prendre avant qu'on puisse arriver à ce niveau-là ici à Lille? Et les 2 dernières personnes qui sont toujours porteuses du virus, comment elles vont?
Alors, j'ai pas calculé le nombre de jours pour le dernier cas, mais j'imagine c'est peut-être cette semaine. C'est 14 jours depuis le commencement des symptômes. Mais c'est des fois plus long que 14 jours s'ils ont encore des symptômes. Et puis, ils ont encore des symptômes, on va les faire tester encore jusqu'à date qui sont négatifs. J'espère de suivre Nouveau-Brunswick et annoncer un jour que tout le monde est rétabli ici.
Merci. I think that brings it to an end, Dr. Moore. So thank you again, Ovely, and thank you to our members in the media for keeping Islanders informed. So have a good day.